Afternoon, everybody, and welcome to the September 2nd, 2025 meeting of the Grant County Community Corrections Board and the Grant County Justice Reinvestment Advisory Council. We are being broadcast out to the public at this point. I apologize to the public who's probably looking at me as I'm eating my lunch. Somebody will write in and let me know if I've got something in my teeth. Let's start out. You all should have received the packet via email, and the minutes of our prior meeting, our May 13th meeting, were included in the packet. And so I will entertain a motion to approve those minutes.
So moved.
I have a motion. Do we have a second? We have a second as well. Motion and a second. Any discussion? All right, hearing none. All those in favor signify by saying aye. Opposed, same sign. I think that motion was by Jocelyn Whitaker and second was by Scott Hunt. Is that correct? We got that. Okay. Next, financial reports. And so.
Yeah, those are all in your packet. Be happy to answer any questions that you have. As always, if they're easy questions, I will answer them. If they're hard, I will give those to Sarah. So, but everything is running true to form, and you'll see that later when we talk about our recent audit. So.
Questions on the financial reports? All right, hearing none, I would entertain a motion.
I'll make a motion to accept the financial report that's presented.
Okay, thank you. Motion by Lisa Dominice. Do we have a second? Second by Judge Meeks. Discussion? All those in favor signify by saying aye.
Aye.
Opposed, same sign. That motion carries. Financial reports are approved. Please note for your calendar, our next meeting is December 2nd, Tuesday, December 2nd at noon. And we'll have meetings here then going forward. Is that correct?
Yeah, moving forward, you all should have on your calendar request, I didn't include in your packet, but the proposed meetings for 2026, and they have all been cleared from Commissioner's office to make sure that we're not running into any other conflicts here with meetings. So
We had to do a little bit of
yeah,
gymnastics to make that happen.
yeah.
Okay, new business, DOC updates. Chris, you want to go ahead and speak to that?
Yeah, go ahead and give the bad news, I guess. So, our recent grant that we submitted, the State Department of Corrections, if you've been following the state budget and what's been happening, with those cuts, most divisions within the state were cut 5%. Community corrections cuts were a little bit deeper. And that resulted in, about $120,000 cut for us. The department also decided that in order to utilize the funds, more effectively as it relates to community corrections, they ceased funding for all jail treatment programs, all prosecutor diversion programs that were funded, and all pretrial programs. Now, those are pretrial programs, just a caveat for that, those are pretrial programs that were funded from the Department of Corrections. Our pretrial program that we have here in Grant County is funded by IOPS, the state. So, I don't know that will result cuts for us, but it could. So consequently, we had to resubmit our grant with those budget changes. In your packet is a listing of what I presented to the commissioners for their approval, and the grant submission. We did this really quickly because we didn't want the funds held up in the contract process. So you'll see the funding that we have is the General Community Corrections Grant of $917,961. and the court recidivism reduction program, which is our reentry court for 233,787. And then, so that's a total of, 1,157,48 is our total amount that we have for funding. We had to cut, a position, out of our grant. Luckily, we had one that had been vacated. And then we had to make up that 121 or 120,000 out of there. And we used that, a mixture of the position that we eliminated and our project income, which is client fees. So we are hearing that there are probably cuts coming in 2027. We're hoping that the legislature does something so that that does not happen, but that is a possibility for us. Answer any questions about that. I also included in your packet our most recent audit, and you'll see that, we received a stellar audit, and most of that, has to do with, Sarah, and our administrative support staff who work really hard to make sure we spend the money appropriately. So, answer any questions you might have about those.
I'd add, Chris, when we were discussing at state JRAC, the funding cuts, and what DOC had indicated their decision-making was in making those cuts were, in essence, any programming that did not directly relate to prison, directly decreasing prison populations, they cut that funding, so.
And I sort of have a bone to pick with them about that because in 2015, when they did criminal code reform, they increased the funding for community corrections to be able to include all the programs that were mentioned.
Mhm.
So they are using the old funding formula that was just simply for community corrections when community corrections came about. 2015, that was supposed to change. And they were also supposed to look at taking any savings that they received from that and put that in to the JRAC Community Corrections Fund, and that's never happened. So, I think a lot of that is they've had transitions in leadership.
Mhm.
So the only thing really in writing as a formula for funding was that old formula.
Yeah.
So that really probably needs to be something, I'm hoping that state JRAC will work in collaboration with DOC because we're held accountable to evidence-based practices, all the things that we need to do from that part of it, yet the funding is still based on the antiquated formula of population and 18 to 24-year-olds or something like that live in. So it's not a comparison between apples and apples.
Other questions for Chris, comments? I suppose we could say that other counties were less fortunate than us. Marion County had to, shutter their pretrial program because it was funded.
Yeah, other counties are less fortunate. However, again, those counties that chose to pick up the ball and do more also suffered the repercussions of what happens when you do more
Mhm.
and got cut. So, but you're right. There were other counties that got cut way more severely than what we did.
Okay, any other comments or discussion? I will take the opportunity, I guess, Sheriff has approached me about looking at maybe thinking outside of the box with regards to our jail overcrowding problem in light of, budget cuts and changes and things like that. So why don't you, maybe this would be a good time for you, Sheriff, to kind of talk about that at this
Okay.
point.
Thank you, Judge.
Mhm.
Just so everybody kind of understands what's going on, I know there's a lot of information that's put out there about jail overcrowding. But the reality of it is this, that we have a lot of programs in Grant County that's an alternative to jail. I mean, we have people on probation, we have people that go to drug court, We have people who go to Veterans Court, we have people who go to Mental Health Court, we have, home detention programs. So there's a plethora of programs out there, that we have. So with that being said, we were thinking, challenge our teams, is there more that we can do to try to get our jail population down? Because I think the last thing we want to do as a community is not hold people accountable. It's, lack of accountability causes more issues for a community than accountability. So we still want to hold people accountable, but are there more alternatives than just, I challenged our jail staff and our team to come up and start thinking outside the box. And as we discussed in our staff meeting today, there's nothing new under the sun, right? We're not recreating anything or creating something. We're just gonna look at things that were already there. And one of the programs that we've had before was, instead of sentencing people for, 180 days in jail or, a small amount of time in jail, we're thinking, could we work with the courts to sentence people for weekends? And then we would have, some of our staff take them out to do work around the community. I know I think me and David, talked about that. I've talked to other people about that. Before it was an issue of staffing, we were so short in the jail. So that's one of the things that, I emailed the judge about. And obviously, it's not something that we can implement ourselves. The courts have to be on board. And I'm not sure how many people that's gonna affect. Right now, we're looking at, I had our staff, they're getting us numbers to see how many people are already sentenced, to do time in our jail. And I'll get those numbers and forward them to everybody. But we thought that was an option, something that we could do. That's something that we could do, pretty quick if we decided to go that route. Now, we may need to get the council on board. We may need extra staffing to do it. But so we have to look at is that gonna save us money in the long run, or is it not gonna save us money? So there's some variables there that we have to kind of look at. But I think it's definitely an option that's worth exploring. So that was one of the things that our team came up with. And then another thing we talked about is, can we expand the home detention program? Because one of the things that we have to realize as a community is that every time you release someone from the jail, these are people that are prone not to follow the rules anyhow, right? And one of the big issues we have in our community is recidivism, same people constantly coming back to jail. They'll complain about the bedding, they'll complain about the food, but they always seem to come back to it. So is there some way that we could get the jail population down with nonviolent offenders, but still be monitored? So we talked about expanding that program. That's something obviously I think is gonna be a little bit more, it's gonna take a little bit more research. We're gonna have to look at the cost of doing it, whether it's gonna be equipment, whether it's gonna be staffing. So I'd like to see if we could get some type of work group together so that we can start at least talking about that, and get that option on the table. I know with the new referee corps, we're starting to get cases going through the system a lot quicker, but I'm not seeing our jail numbers go down. So those are two programs that we're looking at doing. And I think everybody has to realize is the Grant County Sheriff's Office is not the only arresting agency in the state or in the county. So I'm trying to get the chiefs on board, the town marshals on board to continue. We do a pretty good job of doing it, but to see, can we cite more people into court? Can we do those kinds of things instead of bringing them to jail? I can tell you this, if it's a minor offense and they come to jail, they normally get OR'd anyhow, right? So if it's a nonviolent minor offense, we normally OR them. The problem that we're seeing and we're running into, we issue them a court date, they don't show up to court, so a warrant gets put out, and then we end up getting picked up and brought into jail, or they reoffend. Some of those things, we don't control the crime, right? I can't control what people do. But I think there are things that we need to look at and explore to see if we're able to get those jail numbers down. I think those were two good programs, and we're gonna continue to try to think outside the box on what we can do to get those numbers down. is like I said, right now we have those 6 programs that I mentioned earlier. And plus we're ORing people to programs we have with the city court judges, where we don't even have to call the city court judge, but certain offenses, we can just OR them with, they've given us their permission to OR them. So those are the kind of things we're looking at. I think it would be beneficial to get a work group for those 2 things. I'd like to put the work crew, I could call it a work crew, but it's not gonna be a work crew per se. But I'd like to get that going. I think we can do that pretty quickly if the judges decide that's a good idea and they're able to do that. So I'll get those numbers to you guys, but we definitely need to explore the option of home detention to see if that's gonna be a benefit to get those numbers down. Right now, we're averaging about 350, 360, right around there. We recently brought people back to the jail, and it wasn't because we just wanted to bring people back. I'll take ownership of what happened is, we knew we were gonna run out of money, and we planned on going back to the council in August. In July, we had the death of one of our deputies, and then we had the death of our jail commander's mother, who was on her deathbed for most of the month. And just to be honest with you, the budget was the last thing on my mind. My focus at that time was getting our team through these deaths that had occurred. And just to be honest with you, by the time I realized that we were gonna run short and I had to go back to the council, I talked to Angie, and it was too late to advertise to get the additional funding to continue that out-of-county program. So that was on me. I take full ownership for that. But we're going back to the council this month to get more money appropriated to get our numbers back down. But here's the last thing. Here's the thing I told our staff. I don't want that to be a crutch for us to say, hey, here we have money, we can just send people elsewhere. I still want to work on reducing our population so that we can get those numbers down, so we're not sending as many people out of county, because that is costly to the county. And we always want to be mindful of the taxpayers' money. So that's something that we're working on to do, and we're constantly trying to figure out ways of doing that. I know the courts have been helpful in getting people that have medical issues out. We had one guy that had cancer. We're spending thousands of dollars of money that we have to pay by state statute for medical care for inmates. I think it's several $1,000s just for one medication. We were able to get him put on home detention. I think the individual ended up passing away, didn't he?
Passed away last week.
So, and we've done that with, I think, 2 or 3 people. That's really saved us, as far as our medical bills are concerned. And we're gonna look at possibly doing that with more, because we do have a very sickly jail population in Grant County. I don't know if people realize how much time we spend taking people to the hospital. And this is above and beyond our vendor, our medical personnel that we've contracted with to do medical. But if they have a doctor's appointment, we have to transport them. If they have issues while in the jail, we have to take them to the hospital, and that falls on us to pay those bills. Now, our vendor has been very good at being able to get Medicaid to cover some of those expenses for some of our inmates, but they're not able to do it with all of them. So we're still working on that. So if before the meeting's over, we can get that work group together, myself and Captain Camry will be on it, and whoever else would like to be on it. And we want people just that want to think outside the box. Whether it's, it doesn't have to be law enforcement related people. I mean, I want all kinds of opinions. I think we make better decisions when people have input and we're able to get all different ideas. So that's kind of where we're going with that, and we'd appreciate any assistance that you guys can give us, and any recommendations. I mean, we don't know everything, so we're always willing to listen to different ideas.
I'm gonna take that as a motion to form a work group of our local JRAC to address those issues. So I've committed to the sheriff that I'd be willing to serve on that work group as well. So let's go with the formation of the work group first, having, if it's okay, if I can treat that as a motion, Sheriff. Okay, we got a second from Mr. Glickfield. Any further discussion?
Yeah, I'll add some discussion to that. I'm happy to serve on that, a work team as well. Now that and I'll speak to the referee, court, is that as far as processing cases, we've been as high as 275%, and today we're 168%. So we have been operating well above 100% as far as moving cases. Now, your point's well taken, is it affecting, jail overcrowding? I believe that it's probably too early to tell, and I'll tell you why. Because Grand Superior Court 3, we just got our first attempted murder case. We're starting to get these higher level felonies now. We've got our first level F1. We've had F2s, F3s, F4s, F5s, but now we're starting to feel the full weight of a higher criminal docket. And so I anticipate that if you've got another court that is going to serve as a drain, if you will, and not a waterspout, a drain of cases. Because when you have another court, what happens is we're going to go to trial, and you need to get ready on this. State and defense need to get ready on this case. And so if you hold everyone's feet to the fire on these higher level felonies, you've got an additional court that wasn't before now engaging in higher level felonies, then I believe it's going to impact jail overcrowding. And we're getting those higher level felonies. That is the makeup of the jail. For the most part, I got 76 pages of information. I think maybe came from you, and I've reviewed it with our referee, Brian McLean, and a lot of our inmates are not level 6s and OWIs. They're higher level felonies, and to have our court more than willing and able to assist with those cases and getting those through the system quicker, I do believe that it's going to impact jail overcrowding. And I'll also say this, outside the city courts, Grand Superior Court 3 now has approximately 70% of all the criminal filings at the courthouse. So I should probably be on this committee.
And one thing that I've challenged our team is, and one of the things that I've told them is, we have to acknowledge our problem, right? But we can't focus on the problem, we have to focus on solutions. If all you do is focus on the problems, you're gonna create more problems. But if you focus on the solutions, you're gonna create progress. So that's what we wanna do. We wanna focus on the solutions. We wanna acknowledge the problems that we're having, but we wanna focus on the solutions. So if you have some solutions out there that maybe we're not thinking of, feel free to get with me. I'm telling you, people will, and I tell our team, hey, don't come to me with a complaint unless you're bringing a solution with it. And I would put that out to anybody in the community. Hey, if you see a problem at the sheriff's office, that's fine. Come let me know, but bring me a solution if you have one, because your solution may be a good one that we can implement, maybe something that we may not be able to, but at least we'll hear it out. And I think the more we focus on these solutions, I think the more progress we're gonna see in solving the problems that we're having.
Bill, I'll work on it with you.
Okay, thank you.
So all those in favor of forming a work group signify by saying aye.
Aye.
Opposed, same sign. Okay, so with membership, let's talk about membership. I volunteered, Judge McVicker volunteered as well. I heard Jocelyn volunteered too.
I'll volunteer from the defender standpoint.
Okay. And Scott will volunteer for prosecutor. Okay,
I'll volunteer from the council standpoint for the money.
thank you.
We're gonna have to pay for something.
Okay,
And I really feel like we're trying to work, the council's trying to work with everybody, I mean, with the referee court, hoping it would help. The other thing too is not only people sitting in the jail, but also if they've been processed, so to speak, and now they're serving their sentence, I thought they were getting reimbursement for some of those people that are prosecuted from the state.
we should be getting it. We're DOC, if they're DOC committed, yes, we should be
Right.
getting it. Now, I don't know that we're,
Yeah,
Received it
not
yet.
the-
Yeah.
The ISA.
they owe us
The
$150.
ISA is really fighting
Yeah.
with the DOC right now to get us our money.
Right.
Because we haven't been paid since October 2024.
But at least we're accruing something
Yeah.
that we should be paid for because those inmates were processed.
And that's for
sent-
level 6.
Last number I saw was $160,000, I think. Does that sound right? Yeah.
Yeah.
What you sent me, yeah.
They asked, I think the auditor asked for.
Yeah,
what we
that's
were
been a
up
little
to.
bit ago too, yeah.
So that would certainly help. And then, the sheriff and I were meeting last week anyway. But I'd heard about the issue of perhaps money running out, so inmates were coming back. I actually called, talked to the members of the council to kind of get a consensus of agreement. not a good idea, in our opinion, to have that many people here. Granted, we don't want to pay that. But I think we're in a situation where we've started doing that. Putting 50 more people into the jail, overcrowding it just doesn't seem like a good idea. So certainly other ideas to do this would be great. And what I look at, and maybe it's terrible to say this, but it's $40 a day per inmate. So $1,200 a month per inmate, 10 of them, 12,000 a month. So it's like if we could do a program that would save 10 inmates from being in there and somehow, you know, still they're being somehow held accountable for their wrongs. But somehow we could help to save that money, because otherwise I'm looking at the roughly $100,000 a month. It's going out of our community.
Well,
And we need to do something else to hold it back here, because then, I mean, we still got everybody working, doing things here, and, you know, people want raises and things like that, and I'd rather have that money here to be able to do that, but otherwise we can't. So I applaud the effort, and I'm glad to see the teammates stepping up to really attempt to really tackle this problem, but it's gonna continue. And if we can figure out something for that recidivism like you're talking about, that would be fantastic. So thank you.
Melissa, you said you will serve as well too? Okay. And then,
anybody that can, that's.
do you make note, Chris, of everybody we got?
Yes, sir.
Okay, excellent. Good. Why don't we, maybe we can send out calendar invites to see if we can just get a meeting on the calendar, as soon as possible. So,
Well, I appreciate it. I think it's something that's needed, like Greg said, at the end of the day, we're a team and we have to work together to solve these issues. And, I know we're willing to work and do whatever we have to do to get that population down and, other than just let criminals run wild, obviously, we don't,
Yeah.
nothing to do that. I don't think anybody's wanting to, so, but there are solutions out there. We just have to put our heads together and figure out what they are.
I agree. Okay, mid-year performance measures.
Yeah, those are in your packet. I put those in there. Everything's running true to form. The only thing that, is down in our numbers, which would be expected, is as related to jail treatment. Radiant lost the position. That was someone who was trained to be able to deliver the curriculum. And so with the ending date approaching, of jail treatment, they decided not to look to rehire someone to do that. So, right now, we're just operating the MRT that we have available, in the jail.
Okay. I wanted to, I guess, as we're talking about programming, I wanted to just give everybody an update. We are over full in drug court. And so now we're just accepting people that are in the jail, and we will replace people who leave by attrition. Our next graduation is in October, so we won't have a ton of graduates at that time, but we've already got a waiting list for that too. And then also, we will be, I think we're full now as a veterans treatment court as well. So, but you know, you can continue to send us referrals. One of the things that we've looked at is reentry court, maybe taking some of the people that are in the jail as well. We're again trying to be innovative about getting people into programming with that too. So we'll have another graduation in January too for drug court, which will be a larger graduation, and so hopefully we'll continue to kind of keep that going. We have 3 graduations a year rather than 2 now, just because of the volume that we have. DOC data reports.
And that wasn't in your packet, so it's not yet available.
Haven't got it
We'll
yet,
probably
okay.
wait till the end of the year. Part of that is they used to post mid-year what, some of those data reports are. The DOC data that we received was not as clear cut as what it has been in the past. So we're gonna wait till the end of the year and then run it, and we'll hopefully have a more accurate report come January, February meeting of 26.
Okay, excellent. Going to the local JRAC portion of the agenda, SCA 9.
Yeah, that's in your packet, of the latest report, but I also sent, all the group, an email back when it was first came out, so you should have that, the electronic part of it. And then the reports in your packet, that we provide, and this SDA 9 is all around home detention. So it'll be something we can look at also in our meeting as we look at, a work group as far as it relates to home detention.
Opioid settlement work group, we have not met. I know we've got, just kind of as an update, we have one position in drug court that is paid out of the opioid settlements, and she will be leaving us, and so we're looking at rehiring, and so depending on the experience level of the person, they may be a little bit more expensive for the, out of those funds than, because Jai was brand new. And so, although excellent.
We had one more step back too, Judge.
Oh, sorry.
On the
Yeah.
JRAC. So one of the things that we're trying to accomplish, and Judge Spitzer and I met with the Center for Effective Public Policy. It's sort of the state JRAC's technical assistance group. And one of the things that we had, early on was we had a data dashboard that showed probation supervision, and jail data and court data all in one set. When they went to the new Indiana jail system, it separated out that data. And so it's one of the things that I know when Judge Spitzer does the state of the judiciary, or we need to look at jail overcrowding, we can actually click on the individual who's in jail, and it will actually pull up over into Insight all the court information. So it makes it really user-friendly for judges, prosecutors, and even defense, if they want to look at it. Anybody who's, who gets access from the state, would be able to do. Well, when we lost that, one of the things that we met with them about was reestablishing that link, which I didn't think would be that difficult, but I'm not the IT people, but it's a state system that was developed by the state individuals, which is the same system that we have, which is in Insight. So, but we met with them and they asked us to submit, and Judge submitted an email to ask for technical assistance for that. But it's pretty cool. I know for Scott, a couple times I printed out some reports that he needed to be able to look who'd been in jail the longest. And we can get some of that now, but it really makes it convenient for courts to be able to just click that button and they can see the person and then all the court data. So,
The thing that's attractive to them is that if they do it for us, then anybody who's on the in-jail system will have the capability to do that. So, it's a bigger picture than just Grant County.
right.
And so it's gonna be a little bit more, intensive, and frankly, Core Technology has also got a cut in their budget too, so I
That's what-
don't know
Yeah.
how that's gonna impact things at this point.
And they're trying to get money now too to expand the Indiana jail system because they just had enough money to do so many, which is why we jumped on in the very beginning. And I think Sheriff and Jason, you've been happy with the system, haven't you? The new Indiana jail system?
Oh, yeah.
Yeah.
It's working.
Hey, it's free, yeah, so.
Yeah.
There's
No
a
more
more
cops.
jails coming online, so the more that come online, the more you can share information. So I think Marion County and some other bigger jails, Elkhart came online. So that's gonna be beneficial in the long run.
And
I like
it,
using it. I enjoy using
it
it.
helps it out because now when they search used to in the old system in combined public, it just showed Grant County.
Mhm.
Now it's more come online. They can see, hey, they were arrested in Vigo County or wherever, where you would have to search before. Now it's on there.
There'll be eventually a real time.
Yeah.
So we'll have real time solutions. And then the other thing too is that, like, there's been requests from the sheriff, others, for different kinds of reports that we didn't initially have. They're very good at making those reports for us. They
Yeah.
get back to us within the same day usually.
Okay, mental health work group.
Judge, can we go back to the opioid settlement?
Oh, we can, yes.
There was some discussion, I think, during the budget hearings about the opioid settlement funds, and so I wonder if now's a good time to kind of revisit and have time to meet and talk about what those funds are designed for, what they currently are being used for, just so everybody's on the same page. If there's questions or.
Yeah, I mean, if there are questions about that, in essence, the purpose of the funds was for remediation, or for remediation of opioid, of the opioid crisis that was caused by overprescribing. I mean, that's in essence. And so there's a list of sort of permissible things that you can do with those funds. There's a state website that kind of describes those purposes and things like that. So we need to, and they are audited. So they will look at how you use the funds. And so you want to make sure you're using the funds within the prescribed purposes. And we're currently, we've got,
There's two positions.
two positions that are paid.
One is a drug court probation officer, which allowed us to increase that capacity or maintain that capacity
Mhm.
based off of a federal grant that was expiring.
Yep.
And then the second one is a treatment coordinator. And this individual helps to get people into whether it's residential, whether it's sober living, whether it's detox services at a much faster pace than what it was before. I've seen it down to as little as 2 hours. So
Oh,
if
yeah.
someone was in our office, needed those services, was ready for them, technically was pending probation violation, historically would have gone to jail and sat there for a while. We diverted them and had them in treatment within 2 hours. So,
Directly impacts jail population because a lot of the people were sending them from the jail directly to the treatment facilities.
this individual sits on the problem-solving court teams
Mhm.
and also does a lot of our facilitation of groups, in-house groups. So, and those have been running really well. Lots of good feedback from our, even our clients who are asking for additional services, which seems odd, but it's meaningful for them. So
Mhm.
we're looking at all those criminogenic factors and then trying to target those. And they provide a lot of support for that particular initiative as well. So we're hitting it from multiple layers. So I sat with the auditor and walked through that report just a couple of weeks ago. And it was like, well, we do this, but here's our catch-all, but so there were a lot of things that we were targeting even within the one domain. And so we spent a lot of time looking at what can we get grant dollars for. Let's not duplicate those services. Let's get the grant dollars. Let's look at what are additional things we can bring here locally. So that's kind of been the thought process and how we landed there a couple of years ago.
Any other questions on opioid settlement?
Just
There
a comment.
new award that came out too, I think, wasn't there a new?
It's, so,
City has one.
yeah, so the first round, you didn't have to opt in. And you automatically got it, and it was from your prescribers. The second round, jurisdictions had to opt in. The county did opt in, so those are your pharmacies.
Yeah.
And so, the funds are not released at a predictable time. I think the commissioners get an email and say, you're gonna get this amount of money, and then they deposit that amount of money. And so it's not something you can say, we're gonna get X amount of dollars every quarter. And so it's a little hard to predict those things, but, they're putting those 2 rounds of disbursements in the same, non-reverting fund, so. But we have had some talks with the city about, potential, partnerships. I think the sheriff, your office and our office is going to meet with the city again to talk about, ways to potentially, mitigate some of the jail treatment loss and things like that. So, looking at how do we also work with the city, who also has a lot of money, who, the only thing I think they've allocated out of it is to pay for the consultation.
And they, I think too, with that one, they applied for an enhancement grant from DMHA. So every dollar that they spend from the opioid dollars will be doubled. So they'll get money from DMHA if they meet those certain target areas.
Yeah, the award period, I think, is October, and it has to be spent by April. So whatever they choose to do has to be a short initiative.
Marion Health received some opiate money from a different pot than what
Mhm.
was this, what you're talking about, but that funding just ended, last month, but we were able to hire two, a psychologist and a couple of therapists. And so we have seen some pretty strong results from their, working mostly with primary care. We have physicians that are actually almost walking someone down to their offices and they're getting kind of, so we're seeing a better return as far as they're getting into those first sets of appointments, getting in that. And then because our program is not a long-term program, we feel like they're kind of booked, for lack of a better term, to hand them off to the other mental health providers in Grant County. So Dr. French and Dr. Hoeksema are our two that are working, and he will be, right now, Dr. Hoeksema, to my knowledge, is the only one able to do testing in Grant County. She's booked out over a year.
Yeah.
Dr. French will be up and running with that certification and licensing by the end of this year. So that will add another resource, but we're seeing more and more data that people that are not diagnosed with either significant learning disabilities or even mental health issues often turn to, as you all know, drugs, sort of that self-medicating type environment. So we see this as hopefully primary prevention almost way before maybe some of our other efforts that we've done, that we talk about in this group a lot. So we're really hoping to grow that program, and we are also looking for additional funding to help with that. But it really was out of the need of our primary care physicians who said we really need this. And as we know, all of our other agencies are overworked and and understaffed too. So I feel like it's been a really good sort of almost that stopgap that for immediate care, and then we're able to pass it off to the mental health agencies. So we're looking for some of that funding also.
Any questions or thoughts, observations on opioid settlement? Mental health work group, Lisa?
Yeah, so I had spoken with Judge Todd, and what we're thinking right now, you might remember the last meeting that the program had been completely evaluated, and we're like all in now and can maximize that program. We're feeling like it's time to disband this particular work group until there's a new thing that we feel like we need to focus on. So our request for this meeting was, first of all, are you guys all right with that? And if not, what's our charge? I guess is our
Yeah.
next. We understand that mental health isn't going away, but we feel like the purpose of that work group was specific to setting up the mental health court, and we've done that
Right.
successfully. So we feel like, yeah.
Makes sense.
And it sounds like we have a new work group.
Yes. Well, so I hear that as a motion to disband the mental health work group, it having achieved its objectives. Is there a second? Thank you, Judge McVicker. And then any further discussion? All those in favor signify by saying aye. Opposed, same sign. Okay, there we go.
Guess I wasn't fast enough, but I certainly hope that we don't forget mental health in all of this, because it seems to be running such a
Yeah,
Yeah, oh, yeah,
issue.
yeah.
So, hopefully the other work group might pick it up so that maybe we can somehow try to get that population out of our jail population if possible, or give them treatment to help them. So, yeah.
Yeah, oh no, it's still, for sure, it's part of everything we do.
Yeah.
No question about it. Pretrial policy team, Jess, you wanna comment on?
Thank you, Judge.
Mhm.
So pretrial, just some quick data. We currently have over 148 active supervisions. And I would note that on some of those supervisions, they have been on pretrial supervision for upwards 2, 3, 5 years at a time. So we have some clients that have been around for a while. And so at $40 a day, that can definitely add up. So 148 active supervisions. And something notable for our 2025 data so far, of those that have completed supervision this year, we have a 95% appearance rate. So of those that have completed, 95% of them have attended all scheduled court hearings, no failure to appears. Moving on to our NAPSA, so that is our National Association of Pretrial Service Agency. It's our yearly conference, and I have the opportunity this year to not only attend, but also present on a panel for the enhancing of rural pretrial practices. And so that's where we get together in front of basically every agency over the nation and discuss what's working in our rural community to try to impact any other rural communities out there. So it's kind of a great way to show what's working in Grant County. And then lastly, we have our policy team meeting that we meet quarterly. Upcoming meeting is September 23rd, and we're going to be looking at our sequential review process and see what's working with that and what may need to be updated on that front.
All right, so as indicated by Jess, everybody who's on pretrial, if they would have been in the jail instead, we'd be paying $40 a day for them. So pretrial's certainly a money saver, and as the stats indicate, it's successful. Jess and I saw at the last state pretrial meeting a demonstration of a dashboard for pretrial. I think it's going to be pretty cool. It should be rolled out soon, and you can see your kind of real-time stats from appearance rate, safety rate. It's going to be, they're looking at violent crime rate as well. And so this is again, a free thing from the state for us that we'll be able to track our stats. And so at some upcoming meetings, we'll show that to you once it becomes available to us. So,
Yes.
But it's really cool.
Yeah, the no new violent crime rate, I'll note that also any individuals that completed in 2025 of those that were on pretrial supervision, we've had no new violent crimes for those individuals also. And it's a very strict guideline for what constitutes as a violent crime. And with that being said, our pretrial supervision so far have not had any of those new violent crimes for those been released.
That's really good.
Yeah. Okay, thanks, Jess. Any questions for Jess? All right, Juvenile Detention Center, jail overcrowding, work group.
We haven't met, I know we're meeting with, QAW reference to jail, we haven't had a meeting for, been quite a while, they did send an email, excuse me, today with the new drawing. I know the commissioners and the council are still moving forward with the possibility of new beds and new pod out here by the D home. So I think that would be the last drawing that I had was 436 beds total and 8 beds for juvenile. The problem with the juvenile is when we advised RQAW that the standards or regulations for juveniles is totally different than what it is for adults. And they had them all in one room, which according to DOC, they have to be in separate cells. And to say, obviously if it was like Paddock View, you could do that. But since it is a D-home facility to hold them there. So they were going back to the drawing board to do something with that. But I know, and Greg or Chuck may want to speak up to it, but I know the process is still moving forward, so.
Yeah, we've just been waiting to see a drawing of what they were proposing to the commissioners.
Did I send you guys the email that I got today?
No, I haven't got it yet.
I'll forward it to you.
We also are replacing the windows for the skylights in the D-home today. We are definitely gonna start cleaning it, and we'll probably open it for the kids.
I think, Chuck, was there something with the HVAC though that still needs to be fixed or? was that-
We got that took care
Okay,
of,
all right.
and we also got approved to buy a new unit.
New unit, okay.
They're actually doing it today.
Great.
Member reports, anything from the public defenders to report?
Looks like with the council's permission, of course,
really would be able to hire the one opening that he has. We have a potentially younger attorney interested in coming here and working, which is great because for those of you who don't know, most of the public defenders with experience at least are in their sixties. So at some point, we're all gonna be gone and we're gonna have nobody left. So that was very good news. I do want to point out the referee, Judge McClain, is doing everything in his power to, one, get cases moving, and two, get people out of jail. There's been many times, I'm the public defender in there, and I also have my private cases. For example, I have 30 cases this Thursday, which is a lot. But he will, he'll have everyone brought over to his criminal court where he's on issues. Several times he's asked me, I've just stepped up and done it. And he's making sure that just because people don't have money, that they're not just gonna sit in jail, which I think is a very good concept by him. He's hearing it, and, you know, we mostly talk about nonviolent offenders down there. It's mostly substance abuse issues, OWIs, property crimes, that sort of thing. And I think, from my perspective as a public defender in there, that it is really, really moving along down there. I mean, if I'm myself, I'm getting 30 cases resolved a week, that's substantial. And I know Mr. Elliott is going to have to reapportion. I'm sure Scott's gonna have to reapportion more prosecutors in there, because if it's got 70% of the caseload, it's definitely gonna need more attention. So I think that's happening, but things are moving along nicely, and I'm really impressed with the work that everybody's done to get things moving again. I think in all the courts, I think cases are moving now, and I think everybody's filing rate versus completion rate is above 100%.
Yeah, I shared those figures with,
Which is great. So,
Well, and thank you for that, David. I think what it's also doing is it's having another court with higher level felonies. It's allowing our other courts to not have as many higher level felony filings, many less higher felony filings than they had before, which the other courts can then focus on resolving those cases, because you've got an additional 25% that can be allocated to our court. So I don't know if you're seeing anything, Mark, yet, or Nathan yet, on having less higher level felony filings, but I think that would give your courts the opportunity to resolve those. And we probably, I don't want to interrupt your phone call there, probably have less,
that's my wife, she can wait. No, answer it.
Hey, this is, you realize,
I guarantee it.
I forgot what I was gonna say.
Yeah, sorry.
I think the other courts would, you'd have to let me know, but I think the other courts would see less congested early trials because we've got another court that handles higher level felonies. I think that's what I think you'd find, that we'd have less congested early trials. We're giving folks, because the inmates that are in the Grant County Jail are innocent until proven guilty. They need their day in court. And I appreciate Mr. Glickfield's input, because he is in our referee court a lot more than I am, and I supervise it. And so I'm glad to hear that he's pleased with how things are moving. Brian and I, we talk at least once a week. We go over who's in jail, what are we going to do about it, what's our strategies, what are we going to do tomorrow, what are we going to do next week, what's our goals for next month, how do we finish the year strong. So we're having all these conversations at all times, and I do believe it's working well. But I also agree with our sheriff that we probably aren't impacting overall jail overcrowding numbers right now, because we're just starting to see since May those new higher level felony filings in our court, and they've got to wind their way around status of counsel hearings. You get an attorney, then you got to get discovery, then you got to have pretrials and final pretrials. But by the time that these things work themselves through, I think it just doesn't impact our court, because I kind of describe it as having an earthquake and then having a tsunami hit Hawaii or something. So I think we're starting to see some of those things that are going on, and having the council give us another staff member has been immensely helpful, because of the fact that there's a lot more cases that we have to process, because we have approximately 70% of the overall criminal filings in our court. But I have to imagine, not only is it impacting our court, and obviously it is, but I think it's impacting the other courts from not seeing as many higher level felony filings, which I think would give those courts the opportunity to address those cases more effectively, more efficiently.
Yeah, I mean, I think it's early returns, I think are promising statistically as we look at it. Scott's gonna tell you we're trying a lot of cases too, so that, most of those people are in jail. And so that helps as well, too. So I think early returns are positive, I think. And we'll tweak it as we go forward if we need to. Scott, thoughts from a prosecutor's perspective?
I've always said that the jail overcrowding problem and the court backlog problem are two different issues. And I think that's what we're seeing. They do affect each other, but they're two very different issues. But I agree with Judge McVicker that what we're seeing now when getting cases moved to Sup 3, the level 6, it is allowing the prosecutors and the other courts to focus on the higher level and not be, I don't want to say burdened, but I mean, level 6s, they require a lot of time, and they take your focus away from the larger.
A lot of busy work.
It is a lot of busy work, and we need to focus more on the public safety cases, which are your higher felony cases. And so that's what it's allowing us to do. And we are reallocating some staff. There will be changes in October that will be coming that will focus more attention at Superior Court 3, particularly the referee position. And it is going to require a little bit of change up in the other courts, but I think we're okay. The numbers are certainly telling us that that's the right thing to do, but it's a blessing to have a full staff of attorneys, I'll tell you that. Because these cases wouldn't be turning like this if we didn't have public defenders or defense attorneys doing their job and prosecutors doing our job. So, it is a function of the referee court, but it's also a function of public defenders and the prosecutors actually getting the work done too.
100%.
Okay. Lisa, anything you'd like to?
Yeah, probably
Sure.
one of the community needs that some of you and others have mentioned to us is the need for a psychiatric walk-in med clinic, basically. So if someone's discharged from jail and hasn't had like an introductory dose of Vivitrol or some such thing, like we'll be able to do that. We're looking at an October 1st start day to be 3 days a week. I don't know what 3 days the team has decided, but basically someone could just walk in, see Dr. Khan, get assessed, or one of the psychiatric nurse practitioners that have a lot of experience, and so we'll run it that way. I'll give you more details next time we meet, because we should have that more ironed out, but I think that'll help also.
Great, thank you. Marion Health.
Well, we have a couple of things. We have a physician that's on board now that's very close to certification in addictions medicine. And they're going to be offering Vivitrol also through that. And they're looking at maybe even expanding some of the other harm reduction to ER as people come in. So that's one thing that we're pretty excited about. That's kind of a whole new area for Marion Health. Dr. Hoeksema has been working very closely with that, trying to make sure that does. And another thing, if any of you run into people that are having trouble, as we have in the last few years, getting primary care, our residents, primary care, we just took on another. We have 14 residents. The resident clinic is definitely seeing new patients and they do a great job. So if you have people that are struggling to get into primary care in Grant County, that's definitely open. And so if you call one of the Marion Health lines, the helpline or one of the others, just ask for the residence clinic. They're located out at the north where Marion Family Practice is. That's where they're located.
Oh, okay.
Dr. Zambrano is over that program, and it really is. I've had my eyes opened on what a great asset that is to Grant County. And so one of the residents' husband is our new pulmonologist. So
Cool.
that's a great thing because the whole program is about retaining more providers here in Grant County. And then the only other thing, in case you did not see it, on the Marion Health partnered with Ivy Tech for a pretty amazing simulation lab for all of their health sciences in trying to boost people going into healthcare.
Cool.
And so that opening, I think, was a week and a half ago, and Ivy Tech's all ready to take off on it. So those are some positives as far as helping with some of our workforce shortage and then getting people into primary care. So I just wanted to I know you all run into people all the time that said, well, everybody I call says they're not taking new patients. The residence clinic is, and they really do a good job. So.
Well, we run into that a lot in drug court when we were trying to, in phase 1, get them going with, so that's good to know.
And
we will
if
use
they
that
don't have
resource.
insurance, Bridges has capacity now to take more patients.
Okay,
if they don't have insurance.
Okay.
Got a question before we leave this, and it comes back to mental health. What if somebody, and it would be Radiant or Marion Health, what if somebody is in a nonviolent situation, but they are having a mental breakdown? Who would they call? The hospital or Radiant Health or both? Because we have a lot of people who have a lot of mental health issues.
Yeah, we'd recommend they call 988 because then that's just gonna automatically get them
Okay.
to the right resource. And that may be a medical resource or it could be us, but that would be my first and what I would advertise.
Yeah, because sometimes they might go direct to them,
Yeah.
other times they might need medical
Exactly.
clearance through the ER, so that's a
Yeah.
real hard question.
Yeah, and there's professionals answering that are especially trained and licensed and they have the discernment to understand if they need to route it to dispatch for a medical or if they need to contact us.
That's good to know, because before they move to a situation where we have to have the police.
Right, exactly.
And so on.
Yep,
Mhm.
yep, great question.
Good. Andrea?
Our numbers, just like everybody else's, continue to be on the rise. We currently have over 300 kids in cases. 2.5, 3 years ago, we had over 300 kids. We were able to get it down into like the 270s and now we're back up over 300. I lost 2 family case managers, but I was able to replace them quickly. One started today and one starts at the end of the month, which will keep us staffed at 120%. So I can't complain about being understaffed, even though they feel like they are. Our attorneys, on the other hand, there's always that, understaffing of attorneys. We are getting ready to get a new attorney by January, hopefully sooner. There's a pilot program that's coming with some of the DCS attorneys. I'm not sure if are you familiar with that? No, it doesn't affect our county right now. So I believe it's Allen County, Adams County, and Wells County. The DCS attorneys are gonna fall under the prosecutor's office. And so, not all DCS attorneys are excited about that. So one that's not is coming to us. So we have one coming at the end of January, which will be extremely helpful. We need 3.5, 4 attorneys, and we've been working at 2 for a really long time, and they're very, very overworked. So they are looking forward to some help there. But otherwise, we're doing well.
All right. Sheriff, you got anything to add?
Just real quick, I want to thank the commissioners for closing down the government for about 15 minutes or so when we had Sam Fowler's service. I want to thank everybody for their support during that time. It was a very difficult time for our team, and I know the family appreciated seeing all the employees out here as we drove them by the sheriff's office one last time. So thank you guys for doing that. And thank you to everybody for the support. We're still trying to get video court up and running. I know IT's working on that. They're extremely busy with a lot of things, but that's still something that's moving forward. Courthouse security, we have a meeting we're meeting with the state Supreme Court sheriff. He's going to evaluate our courthouse security, give us some feedback on how we're doing things, what we can improve on, what we can do better, maybe what we need to do that we're not doing. So that'll be in October, and we are fully staffed at the sheriff's office, other than the position that'll be going before the council to replace Sam's.
Excellent. Thank you, Sheriff. Court services, Melissa?
I think just adding to the conversation about the referee court, so, as the courts close 200 and some% of their cases, those cases are coming to community supervision. So there's end our start, and so we have been, just flooded with new cases, and, we've taxed 2 of our supervisors to cover the referee court, just because you can't ask more of our staff to do more, because they're getting the cases when they show up. So, just those kind of things, it all trickles somewhere else. And so we've been experiencing an intense amount of cases coming our way.
It's true. Yeah. I know I had asked the council for an additional position, and the council was great, and I believe we left it at, we can talk about it and see how successful this referee court is, and we can re-engage that conversation. So that was where we left it. And I really appreciate the council leaving that open-ended, because I think exactly what you're saying, because if the courts are processing as high as 275%, which I printed that off because that was the record a couple of months ago, and now we're at 168, and we're somewhere in between on every given day. And you can look at it every day, and you can see how many cases on a daily basis, and it even changes the numbers during the course of the day. So it's just great information. But what it's doing is, let's use 275% as an example. They're all going to the department, not all of them, but a lot of them, a majority of them, almost all of them. Some are being dismissed, some being found not guilty. I mean, there's some things that are happening that don't involve the Department of Probation, but a vast majority of these cases that are being resolved are going to the doorstep of the Department of Probation. So they do, and I know we had some meetings, Mike Small helped me, Mike Connor was there. We had all these meetings, and it was all determined that, hey, we will leave this question of an additional probation officer up open-ended. We can have this conversation in the future. It wasn't a closed door. It didn't feel like a closed door.
I would suggest, if in fact the time comes you do it, you have somebody who specializes in drug and alcohol, because of all the possession case level 6 that are going there now. And they need someone who can get to it. Doing it's not new to them.
Yeah, I think, well, Michael is one of them that helps staff that court. He's a certified court alcohol and drug case manager too. So a lot of those cases are coming through our certified court program. So they're required to do substance abuse. All of those staff have to be trained and certified by the state. A lot of those cases that are coming out of referee court do have those conditions to have the
I would
certified court
strongly
program.
suggest that they follow the same pattern that Judge Spencer has done for years, as far as how they handle probation. Because he's had these cases, these level 6s forever, and I believe he's been very successful at it. So now that they're being shifted a little bit, use the same model, same theories that he has put into practice, because I think works. It'll help a lot.
Thank you, Melissa. Commissioners?
We just thank you all for working together and trying to figure this out. Just trying to fix the buildings. They start on the steps this week to the north side, so hopefully I'll get them done by the end of the week. That's about all I got.
Okay.
In all fairness to you guys, it looks good. The compliments that people are saying and the conversations around about inside the building and outside the building and how it looks. And why did it take so long?
Council?
Council, we're just trying to, work with everybody and, trying to stretch those dollars. Trying to do what we can with them. And, I don't know, at times I feel like we're gonna have to be magical.
Well, look forward to seeing the magic. I don't know, look at my colleagues, if we had anything to add from the judges. Judge Meeks?
Sir?
Okay.
Yeah, I've said everything then. So.
Yep, I think we're all working well together. I appreciate the cooperation from everybody, as we meet challenges. And certainly budget challenges don't appear to be going away, and so we're gonna have to continue to do much with little. But I appreciate everybody's cooperation. State JRAC, we had a JRAC meeting that was scheduled for Friday that has been canceled because we didn't have any business. So, not a whole lot to report there. So that brings us to other business. Any other business for the good of the order?
I just wanted to point out that in our package was a video release because you're recording. Are we turning these into you today?
Well, that's what I was gonna ask today, is, so, the last item on that in your packet is like a video release. And Lisa shared it with the idea, I don't know how that works with elected officials. But for individuals that are here, that you're being videotaped because they aren't. These, I guess, are in perpetuity. I don't think these get deleted like some things do. So if you feel like that's something that you do need to sign or whatever, then, please sign that and turn that in to me. I'll put it into our our records. I think you do this with your board, right?
We do these for, yeah, everything.
Okay. So if you have those and can turn them into me, if you want to take it with you and email it to me and scan it, that's fine.
Sure.
Thanks.
Yeah.
And if you haven't noticed today, and you want to go back and look at it, you're all very photogenic, so, you know. You can tell Hope that, she can just.
Yes, I will, yes.
Tell her to skip that minute mark where you.
Where I, yeah. Anything else for the good of the order? All right, with that, we'll show the meeting adjourned.